I said, is everything okay? The anesthesiologist said, well, the blood pressure's low. I saw her heart rate go from the 90s all the way down. And then she said, have you ever had anybody that died? And I don't like when people ask me that. You want to know the scariest moment I've had in plastic surgery?
Yes.
Like during surgery?
Surgery.
One of the scariest moments was when I had a patient who came from, I think, Virginia, and she wanted an abdominoplasty and liposuction. She was extremely nervous, almost paranoid. One of the first questions she asked me was, am I going to wake up? And I thought, I don't like when people ask me that. And then she said, have you ever had anybody that died? And I said, no, but I do know great surgeons that it has happened to, and they didn't do anything wrong. That's why I always feel like you need God involved. You need a covering, because things can happen that are not normal. Weird things happen sometimes. But she was so nervous. I calmed her down. She almost canceled the surgery. And I said, I always tell patients, if you have just this gut feeling, this gut-wrenching feeling that just won't go away before surgery, that something's off, don't do it. Definitely don't do it. Because I have literally canceled surgery when I didn't have an explanation other than my spirit saying don't do it. And imagine all of the preparation that patients go through, the time off of work and everything, and then the surgeon's gonna say, I don't feel it in my spirit. They don't want to hear that, you know. But I've learned to listen to that voice and that spirit. This patient came and she was nervous. Right before surgery, the anesthesiologist came up to me and said, wow, she's really paranoid. And I said, yeah, I know, but, just give her some Versed and calm her down. And I talked to her about faith and prayer. We got in surgery. Anesthesiologist doing their thing behind the curtain. I'm operating. This was my first year out of training, and I was just started my practice. Surgery's going well, no issues. I'm just moving along, and all of a sudden, I look over the curtain. So we're in the operating room, the patient's laying back like this, and their face, we don't see their face. They have a drape and a cover, and the anesthesiologist is sitting behind that drape, that curtain. And so I just saw a lot of movement and activity back there. And I said, is everything okay? The anesthesiologist said, well, the blood pressure's low. And I looked up and her blood pressure was, I think, 50/30 something. It was extremely low. And I saw her heart rate go from the 90s all the way down to the 60s, and then the 50s, and even the 40s. Then it went down to the 30s, and I said, holy crap, this is not normal. So I paused, and I was looking up and I asked the anesthesiologist, like, how long has this been going on? Why didn't you communicate with me? And she said, no, she's been fine. All of a sudden, it just started doing this. And then I realized that she was very small, and I had the retractor lifting her skin up, and I was pushing down on her belly with my opposite hand. And I noticed, because she was so small, I was pushing on her vena cava. And when that happens, you can decrease the blood return back to the heart. We call it decreasing the venous return. Yes. So her venous return was decreased, and I let up off of my hand. It was a normal standard technique, but she was so small and she had a diastasis, so her abdominal wall was weak. I lifted up off my hand, I stopped, and her blood pressure slowly started coming back up. And I was sitting there like ready to run a code on this patient because I thought her heart was going to stop. And that was the scariest moment. And what I learned from that, and that's why I'm so adamant about faith and adamant about someone's spirit and instinct. And that one incident made me like I am today, because I don't take chances with people's lives, and I need them to be ready. I need them to be spiritually ready as well as physically ready, you know. So that was my scariest moment. And then I kind of had some choice words for the anesthesiologist, because if she would have told me, I could have troubleshoot and I could have figured out what was going on. And I eventually did, but she should have told me so. Anyway, the patient did fine, and she never knew anything happened. She was so paranoid that after surgery, she was like, "I'm good, everything's okay." And I said, "Yeah, your blood pressure did go down, but you're fine now." And she did great, no issues.
Oh my gosh.